Welcome dear friends. Today we are here for the discussion of our one of the very important topic in the postgraduate diploma of community cardiology program. That is, the name of the topic is stress testing. To discuss this topic, today we have got experts from National Heart Institute. Just near to me, Dr. Tushar Roy. He is one of the senior consultant in National Heart Institute, and extreme left he is Dr. Sanjeev Gupta. He is also one of the cardiologists working in National Heart Institute. Both of these cardiologists are part of our PGDCC program. And before starting this topic, I would like to inform all the learners, especially all those learners who are going to complete their first year, that your exam will be on the June 2007. The exam dates are 4th, 5th, 6th and 7th. 4th, 5th, 7th and 8th. Sorry, there is 4th, 5th, 7th and 8th June. The courses will be MCC 001, MCC 002, MCC 003 and 4 respectively. And the question pattern will be multiple type of questions, where each questions will be having 4 subcomponent, and each subcomponent will be having true and false type. So your preparation should be according to that, so that you can answer all those questions. And the 31st March is the last date of filling up the examination form. So I would like to guide you how to fill up the online forms. So may I have the first slide please? This is first slide only. Please on the slides. First, once you open the IGNOU account, IGNOU website, you have to visit the www.ignou.ac.in. May I have the first slide please?
Yes.
No, excuse me.
Udhar.
Excuse me, may I have the first slide? This is our IGNOU website. Yeah, this is our IGNOU website, where you can have a quick link, and below the quick link there will be June 2007 exam link, exam forms. This is not visible in this screen, but once you click that button, June 2007 exam form, after that next page will be open. May I have the second slide please? Yeah, this is the second page, where the instruction for the filling up the examination form is written in details, and just beneath the page, which is not visible in this page, there will be again one button where you have to click for the exam form. May I have this next slide please? Yeah, and once you click that things, you will have this type of page where you have to mention the name of the program, that is PGDCC. Once you click the button, PGDCC options will be there, so you have to just click that things, and beside this again there will be one blank column where you have to type down PGDCC. It is here PGDDA because it is trying, I am trying for myself to learn how to do. And after that you have to enroll your enrollment number, you have to enter, and you have to submit the form. And after submitting the form, you will have a new page. Please may I have the new slide please? Yeah, this is the new page for the examination form, where you have to fill up your course and your exam center, and everything will be given here. And once you fill up this form, you will have received a control number, and you will also have a instruction that within this many days you will receive some kind of intimation. So you have to retain that control number, and by which you can later on communicate with the SRN ED division. So this is the procedures of filling the online exam form that I am trying to explain you. And next thing I want to explain you is that especially the first year students who have recently joined in this program, they may not receive the exam books material, study material. So for that, you need to visit to IGNOU website whether IGNOU have sent the books for you or not. And for this, you just go to the IGNOU first home page, that is www.ignou.ac.in. May I have this second slide, please? Yeah, this is the IGNOU main page, and once you go to the student, and there will be again queries, and under the queries there is the material and distribution division. So once you click the material and distribution division, you will have second page, that is for the material distribution page related things. May I have the second slide, please? Next slide. Yeah, this is the page that is coming up after that first click, and you have to click in 2007 because you are 2007 batch. So once you click the 2007, another one page will come. Please, next slide. And this is the page where you have to enroll, enter your enrollment number, the enrollment number which is given in your admit card, your identity card. So once you enroll this, enter the enrollment number and submit the form, the next very page will be coming up, wherever they will describe the material has been dispatched for you or not, and if it is delivered, on which date it is delivered from the headquarter. Everything will be detailed given in this page. May I have the second slide, please? Next. Yeah, this is the page. After that, you are having these things, and here it is written on date, on which date it is dispatched to you, and what in the beneath the page, what are the books sent to you. Everything will be included here. And this is the one way that you have to find out whether they have sent your study material or not. And these are the few information I would like to give. One more most important information I would like to give all learners is, you have to ensure that you have your own identity card. Without having your identity card, you are not supposed to enter in the exam hall. So nobody will entertain you in the examination if you don't have examination form, identity card. And for that, you need to contact with your regional director, who will issue you a identity card. This is the two important information I would like to give you. Anyway, today we are going to start this stress testing. Stress testing is the one of the very important topic in the cardiology. Basically, all of us, we know that our heart function of the heart is determined by various very other determining factor, like temperature, your exercise activities, and your emotional factors, and a lot of other factors. So in this stress testing, what we do is, it is necessary because there are many other conditions by which our the heart attack may be precipitated, like one of these heavy exercise or emotional attack, like this. So in a stress testing, what we do is, we just create a artificial situations and try to find out whether there is any predisposing condition or not, which may lead to the heart attack or any kind of coronary artery disease or myocardial ischemia or not. So because we have two experts to describe all these things, and I would like to Dr. Sanjeev Gupta to start these topics. We are very late, 15 minutes late around this topic, and we'll start this topic, and I would like to request Dr. Sanjeev Gupta to start this topic, that's stress testing.
Thank you, Dr. Biplab. It is indeed a pleasure to interact with you on the slightly complex topic for you, because you have just entered into the course. I'll try to be as simple as possible. And we among ourselves have decided that I'll present you the overview of the cardiac stress test, what it is and why we should go ahead with this test. And then followed by Dr. Tushar Roy, who will discuss everything in detail about the commonly performed cardiac stress test, that is treadmill procedure test or treadmill exercise test. So first I'll start with the overview of the exercise or stress test. In this, as we know, heart is a dynamic organ, and when we go for any study of any organ in the body, we need two information. One is the anatomical structure. Second, how does it function, or what is the functional status of that anatomical abnormality. Once we have done certain tests to identify the anatomical abnormality, we would like to know what is the functional importance, so that we can prescribe the acute the functional status to the person. We can give the functional status to the person and then prescribe the required activity which he can perform. Can I have the slides? Okay. So what is the purpose of stress testing? There are certain specific purpose. First, of course, is the diagnosis of myocardial ischemia. That is the first and foremost important, and this is why the most common indication for the or purpose for the stress testing. Second, once we have identified the stable myocardial ischemia, the second thing is we would like to know how severe is the disease the person is having in the coronary artery. And third thing is, if at all the coronary artery disease is present, then what is the significance, what is the clinical significance to that person, that is how severe it is the disease to the person, and whether he can carry out the requisite activity which has been prescribed or which has been following all over the years. And next indication could be once the person has acute myocardial infarction, then we would like to know that what is the functional status, so that we can actually prescribe the activity which he should follow. Like a person comes to us and we are planning to discharge the person after the acute myocardial infarction, let's say a 5th or 7th day, and he is a laborer, then should we ask him to continue the same job which he is already doing, or should we scale down his physical activity? That is the answer which we can get from the exercise stress testing. And so there are certain investigations that when you have certain situation when we have the person have a cardiac disease and is being admitted for the certain non-cardiac operation, like say cholecystectomy or any major surgical procedure. In that scenario, can we go ahead with that surgical procedure in that given person who has a cardiac disease? So these are the questions which can be answered, or these are the purpose for which we go for the stress testing. Now, what is stress and how do we produce it, and what is the result of this stress test on the heart? Let's see the next slides. In these slides, there is a stress at the center point, and we can induce this stress in certain ways, either by using the drugs or by exercise or by pacing methods. The drug which we commonly use is the dipyridamole and adenosine. The treadmill, we shall be discussing in detail because this is the most common method of inducing the stress or cardiac stress. And then the next most common is the dobutamine, which is commonly used in many centers, especially in the person who is not able to perform the treadmill exercise. And in certain circumstances is the pacing, that what we do is that we put a wire into the right atrium to pace the right atrium, and then we can increase the heart rate and we can assess the functional status. Each of these method had a certain advantage and disadvantage, which we can discuss slightly later. But most of the time, amongst all these 5 procedures, most of the time we are either performing the treadmill exercise test, or rather you will be involved in performing this treadmill exercise test. And second most common is the dobutamine stress test. So once we have induced the stress, then this stress, what we got, once we put a stress on the heart, it brings about the ischemia. And then ischemia can result into the symptoms like chest discomfort suggestive of angina, or sometimes a breathlessness. And then you can have a certain sign, like if you auscultate the heart, you can get the fourth heart sound. So these signs and symptoms can be induced by producing ischemia. And so you should look for these signs and symptoms which are suggestive of ischemia in the heart, which is produced by the stress. And then once you are recording the ECG, then you can see the ST depression, which is the classical sign of cardiac ischemia. Then there are certain other modality like perfusion imaging, and in that perfusion imaging you can detect the perfusion defect, which I'll show you the slides also how does it looks like. Then if you are performing the dobutamine stress echo, in the stress echocardiography lab you can see the regional wall motion abnormality. That is, a portion of the heart either becomes a hypocontractile or a totally what we call is the dyskinetic state. I mean the paradoxical motion of the portion of the wall can be seen. Then in one of those modality like positron emission tomography, we can detect the metabolic abnormality, or that is decreased glucose consumption by the heart. So these are the things which we can detect by inducing the stress and by producing the ischemia. So once we have understood the mechanism of stress, how does it develops the stress, then let's see what are the type of the tests which are available with us. We have a list of tests which are available, and amongst them the most and the most commonly available almost everywhere is the treadmill exercise with ECG monitoring. This is the one which you need to be familiar more, and this is almost because this is easily available in most of the centers. Then next is the stress echocardiography, This stress echocardiography can induce this stress can be induced either by the exercise or by the drug, which I mentioned just now, and then followed by in say in lesser frequency of availability is the myocardial perfusion imaging, followed by radionuclide angiography, and then positron emission tomography. And the last one is mainly a research tool which is not being used clinically and routinely, and it is available in very frequent, less center or very infrequent centers. So these are the type of tests which are available with us, and we can go ahead with any of these tests depending upon the availability. Then does one test has an advantage over the other test? Then this is the next question which is to be answered. So let's see these things. So if you see all these things, all the test has almost similar sensitivity. That means they are most of the time they detect the ischemia roughly about 80% or 85%, but their specificity, that is ability to detect the correct ischemia, is slightly varies between one test to another. And having the dobutamine stress echocardiography and the treadmill is having probably the highest specificity. So once we have come to know which are the test type which are available with us, and we know that there is sensitivity and specificity, then question comes is which one to choose. And as I mentioned earlier, the test to choose, there are certain parameter which decides in choosing which type to test should we go ahead. The first is the local expertise. We have seen that dobutamine stress echocardiography has the highest sensitivity, but the question is that you are working at a center where there is no echo machine is available, or if at all echo machine is available, there is no person who can perform this test, then probably it has no meaning. So the local expertise at the center is important. Similarly, like myocardial perfusion imaging, we use a stress thallium or this other tracer, and these are available in very few centers. So it has, again, it is of no meaning if you are working at a center where it is not available. So the most important thing is the local expertise of performing these tests. Then the second is the ability of the person to exercise.
Sorry sir, I am just interrupting. I think along with the local expertise, facility available on that center,
yes,
and other supportive things also has to be looked into, because if it is in a smaller setup, like they don't have echo as you said, then treadmill is the most commonly or most important.
Because dobutamine, to perform a dobutamine stress echocardiography or myocardial perfusion imaging, you need a good, good amount of the hardware, that is machine, and then plus the person who is doing it for over a period of time.
Yeah.
You cannot develop these skills in a day or two. This requires years of experience and the ability to handle these machines and all those things. So these are the things which most of the time decides as to which procedure or which stress test to be chosen.
Yes.
Then next question is the ability to exercise. If the person has a certain disease in the like peripheral vascular disease, he is not able to obviously exercise, or if you have some orthopedic problem, obviously he will not be able to exercise. Then we have to go for the pharmacological stress test rather than the exercise stress test. And then obviously the ones is obese. If the person is obese or having a body weight of more than 100 kg, then he cannot exercise. Or most of the time we have seen the elderly person who are confined to the bed. Most of the time their physical work is minimum, so they have very little physical capacity to exercise. So these are the things which decide. And the resting ECG, which we shall describe later. Like for example, we say if you have a person have a bundle branch block, then obviously we cannot go for the treadmill exercise with ECG monitoring. And the last is the clinical question to be answered. Suppose you have a disease in two vessels, and then we have to deciding for some procedure for that person. Then question comes is which vessel is more important, or which vessel should be taken care of before the other vessels, or if the person has its resources are limited, then it is again become importance to which of these coronary vessels should be taken care of before the other vessels. So these are the things which decides decides as to which stress test should be choose for. Then once we have chosen the test, obviously as we were discussing, that treadmill with ECG monitoring is the most commonly available test with us. So I shall briefly go about this test, and this is probably you shall be performing most of the time once you go back after your studies. So let's see what are the indication. The indication are same almost I have discussed earlier. That person, when you want to evaluate a person who have a chest discomfort, that is chest pain, once you have confirmed that the person has a angina or heart disease, then you want to see the prognosis and severity of the disease. Then you want to find out whether the person who has a heart disease can go for surgery or no, non-cardiac surgery. Then sometimes these are some unconventional indication also. For example, in patient who have a congestive heart failure, normally we do not subject a person who has a congestive heart failure to any kind of stress test, but there are certain indications, like when you want to assess the functional capacity of that person and prescribe the the type of occupation he should be engaged in, then you can take for the congestive heart failure exercise test in congestive heart failure. Or sometimes in a congenital heart disease, but these are all very rare indication and probably you will not encounter in clinical practice. But in clinical practice, most of the time you will be encountered with the person who has a evaluation for the chest pain, or to find out the severity of or the prognosis of the established coronary artery disease. So once we know the indication, then we need to know which there are certain subsets of the patient in whom you cannot go ahead with the exercise test at, which my predecessor will follow or will in detail. So I'll just briefly go through this, like the person who has subjected the
I think, sir, we should take a break because it is already 1 minute left, and we'll again join in these sessions detailed discussions regarding this stress test, and around after 15 minutes break, that is on 12 o'clock. And before closing these first sessions, I would like to request all the students, then this is one of your golden opportunity that you can interact with the experts. You can interact through phone or by fax, and please send us the feedback pro forma of teleconference. Last time, every time I keep requesting all of you, but last time I received only from St. John Hospital, and it is very unfortunate that we are not receiving any feedback pro forma from you. So we have to decide, think again and again whether it is effective or not, whether it is benefit for you or not. So